Bien,
Voy a
gracias.
hacer una presentación de Vladimir. Vladimir va a dar una presentación en inglés. Yo lo voy a introducir en castellano, voy a presentarlo. Vladimir es médico, graduado en el año 2000 en la Facultad de Medicina de la Universidad de Sao Paulo, con una residencia médica en medicina interna y cuidados críticos. Tiene un posgrado en informática en salud en el Hospital Sirio-Libanés y una beca de investigación en el Hospital Erasme de la Universidad Libre de Bruselas. Vladimir trabajó durante 13 años como intensivista, principalmente en el Hospital Sirio-Libanés, en Sao Paulo, Brasil, donde participó activamente en el proceso de informatización de esa institución y finalmente se convirtió en director de informática médica hasta el año 2019. Actualmente vive en Finlandia y colabora con proyectos globales de Philips.
Perfecto.
Bueno, Vladimir, cuando quieras puedes hacernos tu presentación y dejamos abierto el chat para preguntas, ¿sí?
Sí. Gracias, María, por la presentación. Unfortunately, I'm not feeling so comfortable doing that on Spanish, so I would try to. I would do my best with English. But please, if you want to, anyone, if you want to ask questions, you can do this freely in Spanish because I think that I can understand, and Maria could help me. But for my talk, I will do it on English.
No problem, no problem.
It's a pleasure for me being here. I'm very happy to participate on this event. My talk will be.
Para nosotros también es un placer que estén acá participando.
Thank you. So the theme that we'll develop with you, it will be this Historia Clínica Electrónica y Adopción Médica. I will took some discussion about challenges and lessons learned all over the years that we have with our product, that it's Philips Health Informatics Suite. We are very happy being on these talks because, as you know, this originally, the product that I will talk about was created originally in Brazil. But nowadays we are working all over the world. In Argentina, it's one of our most important markets for this moment. I will just pass here quickly, just for you to take note of the contacts. If I will write it after on the chat as well. So if you want to get contact, please don't hesitate to contact us. The idea is to pass through this agenda. So as a brief contextualization of health care and some of the challenges that we are trying to go on. TASI, that is the name of the product originally, the platform that now is being incorporated in Philips' perspective on this connected care. I will talk a bit about it with you. And talking about adoption, we have almost 20 years of history of adoption, mainly in Brazil, but in other countries. And on these 20 years, I will point some of the challenges and lessons learned. And I hope we can have some time to interact and discuss these topics. So, as you may know, the healthcare context, it's quite complex. Nowadays, we are talking about the care being delivered not only inside institutions as well as on the houses and various scenarios, and supported by different and various technologies that are evolving all over the years fastly, I can say. And when we face the pandemic, we were able to understand how fast things are changing. And I love the presentation that we had just before mine, when you could share the challenges of the vaccination process in a so quick way, and the way that technology could support this important phase of the pandemic facement that we have been in Argentina. But based on this complexity, fortunately, we have some, how can I say, frameworks that we could address on. And based on these frameworks, we could try to reach better outcomes in various scenarios. So I point here the quadruple aim as one of these frameworks that support us to how to go on technology and people and processes to try to offer improved patient experience and better results at the end, whenever the people that should receive care is. And on the top right side, you can see that talking about frameworks, another discussion that nowadays is very important in every level, from a public or private perspective, from an institution of a government or worldwide. The better we can be in an efficiency perspective, the better for the whole population being managed. And for, yeah, on this regard, we are trying to be equitative and offer the more efficient way to take care of people. Our product, it's originally an electronic medical record. TASI was the original name, and nowadays we can say that we can claim that as this product had a global footprint. So we are talking about more than 1,000 clients, vast majority of them in Latin America. Brazil is the first and main market. In Argentina nowadays is the second market based on the number of implementations on process and prospects. But we have some implementations as well in Mexico, Dominican Republic, and some explorations in other countries, mainly Australia and Japan. One go live in Germany as well. And operations in various other countries in which we are exploring and trying to bring the product. We have now some of our hospitals are already passed through the HIMSS evaluation and the EMRAM. So we have 13 level 6 and 4 level 7 hospitals using our products. 11 of these hospitals are accredited by Joint Commission International. And we have the product had some awards. One of them is this related to the design that we are very proud of. Originally, the product was in this portfolio of solutions of Philips. Once Philips acquired the product, we are talking about 2010, it was only one of the products, the electronic care management, I can say, or the electronic medical record. But nowadays, the idea is, as the product was a broader scope, rather than only the clinical content, as well as RC, revenue cycle management, and any other logistics features, so on. We are using them in combination with other platforms or solutions that Philips has. So for this reason, we are talking now on this health informatics platform, in which you can attach various of the Philips products. On the left side, you can see this ECM is our product originally. So these are the features related to the clinical documentation and decision support. But we have other products that could be combined on top of this platform, and on doing this combination, the institutions, governments, and so on would be able to offer care based on their needs. So we can show you here some of the solutions for instance, this virtual consultation and multidisciplinary team collaboration in an eICU, or remote patient monitoring. There are some important acquisitions recently from Philips, just to name some of them, for the connectivity of medical devices, bedside medical devices, a platform for engagement of patients and PROMs, as well as these operational tools or command centers as the patient flow capacity suite. That is the left, the right, the last one at the right, as I can see here. And of course, on top of our APIs, it's possible to connect to other third-party applications if needed, or other solutions. The idea is to be the most open and allow the collaborative work on the platform. Briefly, some historical aspects here. So the solution started on 1999 with this Delphi version, the original version. It was mainly developed to support hospital operations, and then all over the years we have this evolution to this Java technologies, and now since 2015, and the new and all the new customers are running on the new platform on an HTML5 base and the interface level, and some of the portals that are part of the solution that you can see here. So based on internal frameworks developed by Philips, and they're confluent for which the other Philips solutions worldwide are being merged. So start facing, just discovering some of the challenges. Imagine that we have, at that time, when we started with the Delphi and Java version, some of the hospitals are running, of course, they are still running on these platforms, and they should keep their work running on. So with the passage of the years, our technicians decided to create a new architecture in which it's possible to keep these old clients, I can say, or keep the original databases, but on adding some layers on top of the database and of the business aspects, this local framework, this Philips framework called schematics, in which you can create the archetypes and templates to be able to present in a user-friendly experience based on defined and structured elements, as we can see here on the right side. So based on this combination of components and panels, you can create the vast majority of the screenshots and the interactions that the clients would have with. So just for some illustration here, these are some of the examples of some of how the user interface look like. So this is our CPOE. Here you can see the list of the drugs, in the timeline view, what is being administered to the patient, in a medicines or solutions perspective. A view of the flow sheet, in which you can take a look at a glance what is happening with the patient. You can consult vital signs, documentation, inputs, outputs, and so on. Another example is the surgical chart. So you can follow the document and follow the process of the intra and operative process in a single screen in a nice way. Of course, everything that you can see here should be configurable. You can create your own rules to allow and create templates to define what is the best way to present for that specific surgeon or that specific surgery, and so on. And the idea is, on top of this huge and complex amount of information, bring them together and offer in a purposeful way the best way to present this in order to increase efficient satisfaction and access to our clinicians. But what I really want to discuss with you or present to you, and these are some thoughts of the challenges that we have been facing all over these years, but namely now when we are talking about this new world in which you have the tendency of platforms and collaboration, interoperability. We must to think differently. Yeah, this on-premises world or these solutions that could be created in a monolithic perspective, this and only used for specific purposes, should be able to connect with other solutions in order to allow us to take care of the majority of these challenges that we have outside hospitals. So in this regard, we are moving for a while the idea of the approach of product to approach of solution. So we want to offer solutions rather than products for clients, but we should keep the legacy, the installed base. As I mentioned before, we have ancient technologies in the majority of our clients nowadays, and how to upgrade these clients, how to engage new ones, incorporate innovation. I think that this is one of the major challenges that we can face. So with the velocity, safety, and quality needed, and I think that this could be one of the biggest strengths of our solution, because we have been working on that for a while. And as we are selling the product all over the world, it's important to be compliant with some of the safety requirements as well as the regulatory aspects. So it's important to go on that. We are very concerned and taking care to be compliant with these standards, and be local and global. Yeah, at the end, we should be closer to our clients. We should address their needs in one hand, and on the other hand, we should take a look at the tendencies all over the world and the differences. I've been working hardly on a project with the Japanese market. Imagine it's amazing how we can try to adapt the solution to be able to offer care in countries so different as, for instance, Brazil and Japan. I can say that for us, Argentina, it's a very nice experience, because in a maturity perspective, you are a very mature market. I imagine there are some heterogeneity, of course, but talking about maturity and adoption of standards, for instance, we have lots to know with you. And this is one of the reasons why I'm so happy to be able to collaborate and working with you in a clinic with this new client, as well as with the Hospital Italiano as well. Some of the lessons learned, just to finish that, the discussion, it's important to be close on the implementation process. It's absolutely clear. I don't know if you have access to these class reports, but the majority of the institutions worldwide, mainly in US, I can say, that experience some benefits and have a very nice quality of adoptance of the systems. In general, they have one thing in common. The implementation process is led by people that work collaboratively with the users. When we talk specifically about clinicians, the best approach in general is to bring clinicians talking to clinicians. Yeah, of course, the IT department, the training department, it's okay to work with them, but in general, the clinicians sympathize with clinicians, and as they have these, sometimes the common language, it's an interesting approach. I like to present to the clinicians mainly the benefits of their participation on the processes. So I remember clearly in a hospital in which I used to work, sometimes we receive some complaints of the physicians, oh, but I have to fulfill this DVT, deep vein thrombosis prevention access, every 2 or 5 days, and this is a mess. This is bother me. And when we could present them the evolution of the data all over the years and the impact on the prevalence of DVT, or more, rather than DVT, the pulmonary embolism and death related to this complication in our scenario, could reduce in almost 50% the number of people that died in that institution all over the years, based on this standards and protocols approach. Of course, it's not only about technology, it's about technology, processes, and people, but of course the technology support people to take the good decisions. And from that day on, I have never received any other complaint about physicians when they understood the impact of their actions on patient safety on this example. To have a product that should be compliant with various and different scenarios is absolutely important, and a good best practices to follow standards. And this is where I think that we can learn a lot with you, talking about standards, name some since the HL7 standards until other such as terminologies, SNOMED CT, and so on. So how we should incorporate these standards in our processes in order to support us to be compliant with needs all over the world. Handle technology in a long-term perspective. Of course, you have what you have today, but you have to create the basis to support the future. We know that things will change. This is the only certainty that we have. We have to create an architecture that should be able to support or to adapt to these changes. And this is what we should go on nowadays. And it's a cliche, I can say, but it's absolutely true. Yeah, once you listen your clients, the ability to be able to get the needs, this is the best feedback that you could have. And with a huge amount of clients as we have, it's interesting because you have always have some of them, the front runners that are pulling you. So we should and we take special attention on them. And I think that from Argentina we will have this on some of the fields that we've been discussing based on the maturity that I mentioned earlier. So these are some of the thoughts. I would like to again say that it's a pleasure for me being here. We have a long-term friendship with Ospedale Italiano. This is a picture. I don't have many other pictures. I have some with Charlie, with Daniel Luna. This is one we had on 2015 when the MedInfo took place on São Paulo. It was a pleasure for us to be there. And,
Luciana, Rubin, Charlie.
Yes, Charlie. It was
John, que es un ex residente que ya no está en el hospital, está trabajando en Chile.
Okay.
Sí, Fifar Plazota. Este es un MedInfo, ¿no?
Yes, 2015. Yes, exactly. And this is in the hospital that we used to work. So Hospital Sírio-Libanês. It's very close to us. So we received this visitation, and it was very good. And we should keep contact. I've been participating of some of the evaluation on HINS with Daniel Luna. So it's a pleasure to be with you again. I will let here my email. I would type in the chat as well. And I'm absolutely available for discussions. And if you want to interact, it will be a pleasure for me. Thank you, Maria, for this to host me. Thank you.
Thank you. Vamos a ver si hay alguna pregunta en el chat. Bueno, mientras tanto te puedo hacer algunas preguntas. ¿Te las puedo hacer en español? ¿Me entendés?
Sí, sí.
¿Te hablo?
Sí.
En Argentina, ¿tienen implementado TASI en algún hospital ya? Porque como que nombraste que Argentina tiene, o sea, están en algunos hospitales en Argentina, pero ¿están implementando en algún hospital?
Sí. I think we have one implementation. We have 3 on process, implementation on process, some prospects and some discussions. I'm not sure. I've been working recently on some discussions with Group San Luis.
San Luis.
Yes, but okay, yes.
Okay.
Yeah, this is, thank you, Veronica.
Buenísimo.
Thank you, Veronica. Yeah, this is where we can have some benchmarking.
Su primer lugar de implementación de TASI acá en Argentina.
Yes.
¿Y ahí ya tienen algún tipo o sea, ¿están en la capa clínica ya o están más haciendo la parte administrativa? ¿Están implementando la parte todo?
Since I know it's all the EMR and the ERP and the logistics and
Buenísimo.
running all the processes. And Vero had written as well that it's in Grupo Oronio.
El hospital de Posadas está en proceso de implementación. Buenísimo. Mostraste un poco de lo que era el soporte de la toma de decisiones, los CDS. Quería saber, esa capa de soporte de la toma de decisiones, cada hospital que implementa TASI la puede ir ajustando a sus necesidades, las reglas de negocio por debajo.
Yes, yeah, we have. In fact, we have 2 scenarios here. Of course, we have some of the rules that are already there, the ones that come from consolidated literature. So it's already there. We have some of these standards that are that could be consumed as they are. So as general rules, it's already in the system. But we have some solution, a feature of the solution that is called Mentor, in which you can create your own rules and create your own pathways to be able to create decision support based on these home built, I can say, implementations.
Y mi última pregunta, después si quiere alguien del grupo, después en el chat pueden preguntar, una vez que ustedes implementan o comienzan la implementación dentro de un hospital o de un sanatorio, la post-implementación o el seguimiento post-implementación que hacen, ¿qué tiempo les lleva normalmente ese acompañamiento post-implementación?
This is a good point. This is something that we don't have any standards on that. Of course, we can discuss, but in general, we keep with the clients as long as they need under our previous contract. We have some, of course, once the client needs, we will be able to get on and to offer some of the support. But I can say that we have some groups in which we have this post-go live being handled in weeks. We can stay for 1-2 weeks. Recently, we have just just for example, some institutions in a huge group here in Brazil, in which we stay with them 2 weeks after. But of course, for some others, depending on the local digital literacy or specific needs, we can stay longer. Okay. I can say that in general, in average, I can say that we stayed some weeks, from 2 to 4, 6 weeks. But of course, it depends on the needs and the contracts that we can have with them.
Okay. se encarga de todo lo que acompaña al cliente en la etapa postventa. Ok, buenísimo, Pablo. No, como para saber eso, o sea, una vez que ustedes ingresan, después deben tener el equipo postventa que los sigue y cuánto tiempo. Bueno, no sé si hay alguna pregunta. ¿Hay alguna
just
pregunta
adding here
más?
that just adding here that I would like to thank to Veronica, that is supporting me with this, and I think that Vero and Pablo and Khalil, yeah, we have a team here that could support us on this. So I just let my contact here. If someone would like to share some information,
Okay.
I'm more than happy to do that. And would like to thank you again, Maria, for the opportunity.
Thank you for you. Bueno, si no hay más preguntas, podemos dar por cerrada. No sé si hay alguna pregunta más.
Una última pregunta, Vladimir.
Okay.
Un gusto. Hablaron de la fase de post-implementación y quería consultar si ofrecen alguna herramienta de BI o Data Analytics que permita a las instituciones poder hacer un seguimiento de sus objetivos y las metas planteadas, o incluso el monitoreo de lo que ocurre posteriormente con el sistema.
Thank you for the question, Alejandro. Yes, this is a good question. Embedded in the solution, we have some analytical capabilities, I can say, for various scenarios. So KPIs for management team, as well as for the clinicians and so on. I cannot say for you which are the specific ones based on the implementation process, but I know that we have some. But we can offer as well some, how can I say, on the services perspective, the ability to export or to create some way to offer this information for third-party facilities, and you can manage this with your local tools, or for instance, in the hospital in which to work with. We had lots of various BIs on ClickSense created on top of the information that we could extract from TASI. So yes, you can have embedded analytical capabilities as well as external ones.